What's up YouTube? My name is David Warren and welcome back to this week's video. If you're new to this channel, consider subscribing. My channel is all about being a nurse practitioner and being a CRNA student. In today's video, I really want to take you through what CRNA school has been like. So I started in January and we are currently in September, the very end of September, about to be October. I just finished as of Friday. So today is September 25th and it's Sunday. So on Friday, I finished quarter 3 of CRNA school. I've got 2 more quarters of didactic left and then I'm off to clinical. And I really want to take you through, like, from day 1 all the way up until now, what things have been like for me and what CRNA school has actually been like. Because I know whenever I started anesthesia school, or whenever I was getting ready to start anesthesia school, I was like, what is this actually going to be like? Like, what am I actually going to be learning? What am I going to be doing? And this is the video for you because I want to take you through what I've done from like day 1 up until now. And I want to really break it down for you and show you what anesthesia school has actually been like. So I've done some other videos kind of related to this, but this is kind of the first comprehensive video I've done from like day 1 until now. And I really want to take it from then until now. So just to give you a little background on the program, I'm at National University in Fresno, California. I'm in a front-loaded program. It's DNAP, 3 years / 36 months. And I started January 2nd or 3rd, and it's broken up into 4 quarters a year. So basically like winter, spring, summer, fall, and then 1 quarter in the next spring / winter, and then I'm done with the didactic portion. My program's front loaded, so all the didactic portion is up front. So taking you back to quarter 1, that was January to about the end of March, and that was really kind of dipping our feet into what anesthesia school is going to be like. So that quarter I took 4 classes. There was anatomy, evidence-based practice, anatomy lab, and pharmacology. The pharmacology class was called like advanced concepts of pharmacology, but it was really like an intro to anesthesia pharmacology. So I'm going to break those classes down kind of one by one. So the anatomy class was very interesting. It's taught by one of our professors and he teaches the subsequent physiology sequence. So we take anatomy, or we took anatomy that first quarter, and then in quarters 2, 3, and 4, we take physiology 1, 2, and 3. And so he teaches the anatomy course and then the physiology 1, 2, and 3. And basically the way he put it was the anatomy course is going to be like a general overview of all of the 3 physiology courses. So it's like a whole lot of material jam-packed into 12 weeks. So my quarters were 12 weeks long, with about a week break in between, except for this last. So between quarters 3 and 4, we didn't really get a break. We got a weekend. So I'm on my last day before I start quarter 4 tomorrow. All that to say, this professor taught anatomy, and then he taught physiology 1, 2, and 3. In the anatomy course, we did really a general overview of like whole body anatomy. Hit all of the systems. We started with biochemistry and cell, and then we went into like skin, and then we went into muscle, and we went into bone, and then we started getting into the organ systems like cardiovascular, neuro, central neuro, peripheral neuro, GI, respiratory, hematology. We really like hit all of those systems over the course of 12 weeks. And in that course, we had 5 tests. We had 4 tests and a final. And then to go with that class, we had our lab. And so with the lab, we used a software called Visible Body, and it's like an online anatomy lab, like virtual 3D, AR, augmented reality, I think this word, whatever it was. Anyway, it's been so long ago. We use an online software to study the lab portion of anatomy. And so in the lab portion, we really went over like the cells, the tissues, all the structures, muscles, bones. The bones I really didn't think would be that important, but they actually are pretty important, especially for anesthesia, because you're doing regional anesthesia, nerve blocks, that sort of thing, and it really comes into play. So that was actually very useful looking back. And then we did obviously all the like GI, respiratory, cardiac, hematology, really all the things that go with anatomy. And it's called advanced anatomy, and there were some advanced components to it, but it was somewhat like an undergraduate anatomy class. Like, it wasn't really anything new for me, or probably for anyone, because we've all taken anatomy. So it was a big refresh, because I haven't had anatomy in like years. And so it was nice to have that, because it really refreshed and brought all of that stuff back up. Now, this wasn't a physiology course. This was strictly anatomy. No physiology was in the course. It was just structure, not really much physiology at all. Like, he would briefly go into a little bit of physiology, but overall physiology was not the main point of that class at all. It was really just anatomy. And then in our evidence-based practice class, that was really learning to like look at research articles to determine the strength of evidence, to determine if it was a quality study, and then to try to make application to that to the anesthesia field. And so it was much like any like undergraduate research class. I mean, it wasn't really anything crazy. The first quarter has probably been the easiest quarter, honestly. It was kind of like dipping our feet in, getting us ready to go for harder things. And then at the end of that evidence-based practice course, we had to do like a project. We had to come up with like a PICO question, and then do like an evidence-based project based on the whatever our topic was. And that was kind of to dip our feet in and get us ready for the DMP project, which would come at a later time. But it's really like kind of dabbling your feet in the waters, so to speak, on getting ready for what that project would be like in the coming quarters. And then our pharmacology course was actually really interesting. That was probably the most interesting course, because we really delved into anesthesia. We learned about inhalational anesthetics, IV induction agents, narcotics, narcotic reversal, benzodiazepine reversal. Those were like the main core concepts. And then we did like, at the beginning of the quarter, we did like pharmacokinetics, pharmacodynamics, and then basic human physiology for pharmacology. And so it was just like a broad general overview of really everything anesthesia drug-wise. We hit all the major anesthesia drug categories, which I found a little surprising to be like in the first quarter of anesthesia school, really hitting on those heavy topics. So looking back now, as we're getting ready to take the C exam, which is the SEE, self-evaluation exam, it's an exam administered by the NB CRNA. It's like a mock board exam. And for my program, we have to pass that exam to pass didactic to go to clinical. And so looking back at all of the anesthesia pharmacology that we had first quarter, it's like, I've got to go back and review all of that, because I've forgotten a little bit of it, but I've got to go back and review that. And so it's kind of good and bad. It's interesting that they put it at the front of the program, that very first quarter, where you're learning all of the anesthesia medications, but then it kind of comes back, you're like, I really need to review that the later you get into the program. So it is what it is. But we did learn a whole lot about anesthesia pharmacology in that particular class, specifically all the drugs. And just to say a word about anesthesia pharmacology, it's much different than, say, like NP pharmacology. Contrasting that with NP pharmacology, like when I went to NP school and I did pharmacology, we really learned, like you did in undergrad pharmacology, like the drugs, the side effects, the mechanism of action, when you would prescribe this medication, things like that. And in anesthesia pharmacology, it's much more based on the like cellular level. And so, for instance, we would take morphine, and then we would have to know the chemical structure of morphine, and are there any active metabolites of morphine, and what receptors does the morphine molecule interact with, and what intracellular responses does that cause. And so it was really, the pharmacology aspect was tied in with physiology. And it's very interesting because the textbook we use is called Pharmacology and Physiology in Anesthetic Practice. And so the physiology really came into play in pharmacology. And I didn't really see that happening, but it does make sense, because you have to understand, like, how does the molecule interact with a receptor? What receptor does it interact with? Are there active metabolites? What breaks down the molecule? What enzymes act to break down the molecule? So all of those things play a huge role in anesthesia pharmacology. And so that was kind of a broad overview of what the first quarter was like. It was probably the easiest quarter. It was the busiest quarter because we had an exam pretty much every week. And so we would have either Zoom lectures or in-class lectures, and then we would go to campus to take our exams. And we were on campus for lab. We met in our lab class usually once a week. In the lab class, I forgot to also mention, we did ultrasounds. We had to purchase a butterfly ultrasound. machine. And so we started learning ultrasound really day one of the program, which was super helpful because it gets you ready for like what's to come, especially in the coming quarters where we learned about regional anesthesia and peripheral nerve blocks. It was super helpful to have that background in anatomy and already putting the probe on each other, visualizing anatomic structures, knowing where we are. So that was another thing in the lab class that was super helpful. So that's kind of a broad overview of the first quarter. It was much of like dabbling your feet in anesthesia. There was not a whole lot of anesthesia specific stuff in the anatomy class. The anatomy lab, again, we did more ultrasound type structures. Pharmacology, very anesthesia focused because we were just learning all the anesthetics, either inhalational or IV or pain medication, things like that. And then the evidence-based practice class, we could probably knock that out of the way within the first few weeks, kind of put that aside and not worry about it until we had some due dates coming up. So that's kind of what the first quarter looked like. Second quarter was very interesting. So second quarter was from April until the end of June, and second quarter hit kind of like a ton of bricks, honestly. We took Physiology 1, Principles of Anesthesia 1, Sim Lab 1, and Pharmacology 1. So if you recall, the last pharmacology was called Advanced Concepts of Pharmacology. Second quarter pharmacology is called Pharmacology 1. And so I'm going to break those down again by class. So in our physiology class, that was probably the toughest class I have ever taken. Very hard. It was all neuro. So I've actually got the syllabus pulled up here. I just want to like read you kind of what the syllabus, what the topics we were covering. So week 1, we did homeostasis, feedback mechanisms, the cell, energy generation, membrane transport, diffusion, membrane proteins, and active transport. Really, the whole quarter was spent at the cellular level. We really learned like what happens whenever an action potential is generated. What is an action potential? What's the difference between an action potential and a graded potential? What's the difference in those two things physiologically, and how does that play into the cellular level? And the second week we did membrane potentials, basic physics of resting membrane potential, nerve action potential, propagation, saltatoric induction, and refractory period. And so as you can see, like that's what the whole semester was like everything at the neuromuscular junction. And then after we did 8 weeks at the neuromuscular junction, say the action potential comes down, activates voltage-gated sodium channels, and then the voltage-gated calcium channels release the neurotransmitter. It all comes down to like the cellular level. And it was so fascinating. But after we got done at the cellular level, then we started getting into pain and somatic sensation. And so we learned all of the spinal cord pathways, pain pathways, somatic sensation, and then we got into the autonomic nervous system in the last week. So that was a little bit of an overview of physiology. I'm not going to read like every week and what we did, but you kind of get the picture. It's very much neuro-focused, that first physiology course, because looking back now, it really helped because when we got into cardiac physiology this last quarter, it really helped understanding, okay, what's an action potential? What's the difference between a cardiac action potential and a skeletal muscle action potential? So it really helped starting with that foundation and then getting into the spinal cord pathways, pain pathways, motor pathways, sensory pathways. All of that was very much over my head. And so the first quarter I made all A's. This second quarter I made a B in physiology and I made an A in everything else. So physiology 1 was my first B of the program. It was very challenging. All to top it off, we only had 3 exams. So we had exam 1, exam 2, and then a final exam, and that was it. No other points were added in. So the exams were like very high stakes, if you get what I mean. So the other courses we were taking, Pharmacology 1 was more of a continuation of that first pharmacology course we had. We did sympathomimetics, sympatholytics, diuretics, anti-nausea medication, vasodilators. Let me see, I can pull my syllabus up here and see if I'm missing anything. Antiarrhythmics, neuromuscular blocking agents, and local anesthetics. That's really what we did in that course. There was a heavy focus on the neuromuscular blockers and local anesthetics, and I really didn't anticipate that. I really didn't think local anesthetics would be that big, but come to think of it, literally you're using locals every day. Like you're using local anesthetics in your spinals and epidurals, and you're using local anesthetics in peripheral nerve blocks. So very common. That was a heavy hitting course on those drugs. And then in our sim lab course, that was also an interesting course. It was mainly focused on like the basics of anesthesia. So we went to the sim lab with these high fidelity mannequins, and we started out with like advanced airway assessment. And we started out like learning how to assess an airway, what constitutes an airway assessment, what does a difficult airway look like. And then we went to airway management. How do you intubate somebody? What is direct laryngoscopy versus video laryngoscopy? What's a Mac versus a Miller? What are different ways to do intubation? Nasal intubation versus oral intubation. And then we went into like putting somebody to sleep. What does it mean to do an induction? What does a typical induction look like? What's the difference between a rapid sequence induction and just a regular induction? And our final for that class was doing an induction, maintenance, and then emergence. So really like getting somebody in the OR, putting them to sleep, maintaining them through the procedure, and then emerging the patient, extubating them, and sending them to PACU. So that was really interesting. And I feel like that's what we're gonna be doing the rest of our career. Like we're gonna be putting people down, getting them through the surgery, waking them up, and then sending them to the PACU or sending them to the ICU. And so that was cool. That like brought everything together all in one. And so that was a really neat course where we learned how to do that. And I forgot to mention, at the very beginning of that course, we started with the anesthesia machine. And I did not have an appreciation for the anesthesia machine, honestly, and all the intricacies and the workings of the anesthesia machine. And so if you're a CRNA, if you're an SRNA, you know, anesthesia school honestly is like being like catapulted to another planet, put on that planet, and expected to survive with people who don't speak the same language as you. And so there's just so many like random terms and things you have to know about the anesthesia machine and just about anesthesia in general that like nobody else really knows because it's so specific and like only anesthesia deals with it. Like with the anesthesia machine, there's an APL valve, there's a high, intermediate, and low pressure system, and there's the common gas outlet, and there's a scavenger, and the CO2 absorbent, all these things that it's just like, what are you saying? The oxygen flush valve, all these things that are just like, what are you even talking about? And so it was really interesting that first few weeks, like learning the anesthesia machine, learning what the machine's capable of, and knowing it inside and out. And so that was really cool. After we did that, that's when we got into the airway assessment, intubation, putting somebody down, waking them up, that sort of thing. So that's what the sim lab class looked like. It was very interesting. The principles of anesthesia course, this was our first course on like anesthesia specific stuff, on just like, what do you got to know about anesthesia? And so in quarters 2, 3, 4, and 5, we take principles of anesthesia 1, 2, 3, and 4. So I just finished principles of anesthesia 2, getting ready to start principles of anesthesia 3. Principles of anesthesia 1 course was interesting. We started again with like the anesthesia machine, and then we went into preoperative assessment. What are you assessing your patients for? We went into neurologic monitoring during the procedure. If you're doing neuromonitoring, what does that look like SSEPs or BAEPs? And then we went into airway management. What are like the textbook things for airway management? So what constitutes a difficult airway? What's the Mallampati score? How do you calculate a Mallampati? What's the ASA score? What's a Cormack-Lehane score? All those like airway assessment. The ASA is not an airway assessment. It's like more like a physical status, but the airway like risk stratification tools, learning to assess an airway, and then learning like what's a difficult airway, what makes for a difficult mask, what makes for a difficult intubation, those sorts of things, learning the difficult airway algorithm. And then we went into positioning. I kind of had a bit of an underestimation for that as well. Positioning during surgery. So like how do you position patients to avoid nerve injuries? And then we did fluid, blood and blood components. Then we did outpatient anesthesia, also called NORA, N-O-R-A, non-operating room anesthesia. That really wrapped up the Principles of Anesthesia 1 course. It was really interesting. It was, again, just a huge focus on on the basics of anesthesia. So that brings us to quarter 3, which is what I just finished. In quarter 3, we were in Physiology 2, Principles of Anesthesia 2, Sim Lab 2 and Pharmacology 2. So that's the sequence that I just finished. And so in our physiology course, that was interesting. We're starting to get more into like the body systems and not these like esoteric concepts of the neuromuscular junction. So in our physiology class, we did GI physiology, endocrine physiology. For the first 4 weeks, we had 2 weeks of each. And then for the remaining 8 weeks, we did cardiac physiology. And it's really hard to think that you could do 8 weeks of cardiac physiology, but we really did. It was all like cardiovascular. So it was cardiac physiology, the cardiac cycle, acute blood pressure management, chronic blood pressure management, circulatory physiology, things like that. And so that was an interesting course. I was really looking forward to the cardiac physiology because I just find that fascinating. And you just go so in depth. You just go so in depth down to the cellular level. Like, why is a cardiac action potential longer than a skeletal muscle action potential? Well, it's because of the calcium channels in the plateau phase. And so just little things like that are just really interesting, and things that you kind of take for granted or that you may not even think about, but that play into your anesthetic management of patients at times. And then in our pharmacology class, this was our last pharmacology class, and it was kind of like a hodgepodge of things, honestly. It was it was odd because it was not super anesthesia focused. It was more like, okay, we're going to talk about all of the drugs that are left over and how they impact your anesthetic. So patients that are on like chronic blood pressure medicine. So if they're on like an ACE inhibitor or a calcium channel blocker or a beta blocker, how does that affect the anesthetic that you're giving? Or if they're on antipsychotics or anti-seizure medications, how does that affect the anesthetic that you're doing? So it really wasn't so much of here's your anesthesia medications. It's more of these are chronic medications the patient's on, and this is how it affects your anesthetic. And so it really wasn't that interesting, honestly, but it did have a lot of implications for anesthesia and boards, just because like you have to know like how something affects your anesthetic. So that was a little bit about the pharmacology course. The principles of anesthesia course was actually really fascinating. It's probably been the hardest course that I've taken because we had on average 7 to 8 PowerPoint presentations per week, averaging about 100 slides. I actually calculated up, I strung all my notes together for Anesthesia 2, and at the end of the quarter, we had over 2,700 slides for the whole quarter on Anesthesia 2. It was an interesting course. We started out with regional anesthesia, so we did spinals and epidurals, and we did nerve blocks, upper and lower extremity nerve blocks, then we did cardiac anesthesia, then we did respiratory anesthesia, thoracic anesthesia. It was really like regional anesthesia plus cardio and respiratory. It was interesting. It was hard though, quite hard. 3,000 PowerPoint slides, that really gets to you. And then in our SimLab course, it was initially focused on regional anesthesia. So we did spinals and epidurals. Our checkoffs during this course were doing a spinal and then doing an epidural. And then we also learned regional anesthesia. So we put the ultrasound on each other on upper and lower extremities. We started with like interscalene blocks, brachial plexus interscalene block. Then we did supraclavicular, infraclavicular, axillary, and we did lower extremity blocks. So we looked at like the femoral nerve block, the ping block, the adductor canal block, things like that. And then at the end of that, we did like some more airway stuff. We did difficult airway, and then one lung ventilation. And the one lung ventilation was actually really, really interesting. I had never heard of that before, but it makes sense if you're doing either a mid-cab, which is minimally invasive cabbage, or if you're doing a VATS procedure or some sort of mediastinoscopy or like thoracic surgery, you're gonna have to drop a lung. And so basically you have a double lumen tube is like a 30 something French, 39 to 41 French, massive tube. There's a bronchial tube and a tracheal tube, and you have a right and left, and it veers off, it kind of curves depending on which one you're using. If you're dropping and you can intubate, sorry, let me get my words right here. You can place the tube, and basically you're trying to main stem either the left or the right. The problem with main stemming the right is once you get into the main stem, it immediately juts off into the upper lobe, and so you can actually isolate the upper lobe, or you can isolate the middle and lower lobe only, and you'll leave the upper lobe inflated. But so you typically want to drop the left lung, all that to say. So you you intubate the patient, slide it through the cords, turn it 90 degrees, and then you main stem the patient in the left. And then you can either, so you have a bronchial tube and then a tracheal tube. On the bronchial tube, you can drop the left lung, or you can ventilate the left lung and drop the right lung through the tracheal tube. So you're main stemming the patient to drop a lung so they can perform surgery, basically. But there's all sorts of physiologic implications that go on in one lung ventilation, way out of the scope of this video. Not going to get into that here. So that's a little bit about, like, up until now, up until where I'm at now. I would say some of the most challenging parts have been the studying, the nonstop, like 8 to 10 hours a day of constant studying. It just, like, oh gosh, it just gets so old sometimes. Studying day after day after day. It's really important to take breaks, take some time for yourself, but that's a little bit about what CRNA school has been like. That's an overview of where I have been up until now, kind of the things that we've gone through. I'm getting ready to start Q4 tomorrow, actually. And then after Q4, we'll have Christmas break, and then we come back to campus for Q5. After Q5, we're done with didactic. We go into clinical, and we're kind of on the home stretch from there. So comment below if you have any questions. I would love to chat with you. Thanks for watching, and I'll see you next time.